With Liverpool playing at home and the city packed to capacity, it could be a busy night shift for ambulance crew Ian Doyle and Ken Hornsby.
164, emergency call, please.
164, go ahead.
RTC, car in the Thames with multiple occupants. Fire on scene of it.
We're going to the Anfield area, L6. Haven't given any injuries, but patient is conscious and breathing. Won't know until we get there what's actually going on, so we assess.
Big match tonight. Full house. Champions League, isn't it? You can see all the traffic building up. It's a bottleneck for Queen's Drive. Should have been there myself. I'd give me ticket to me brother.
Is that us?
Yeah. Well, nice kid, wasn't it?
A car has skidded and crashed through some railings.
Hello. Hello. Who's driving? Luke's in the car.
Ian and Ken can only find one patient.
Basically, 3 in the car. This is the only chap that's left.
Come on, Ken, talk to us up.
Now, where do you hurt at the moment?
Back.
Mainly your back. Centre of your back?
Yeah.
No seatbelts on? No. Did you hit anything when the car?
We're going slow and like another car come from behind, like slid us across.
Yeah, but it's slippy there because I skidded as well. All right. How old are you?
16.
He's complaining of back pain, and I can see the mechanisms of injuries there. He's been thrown. Okay, mate?
Yeah.
Take a deep breath in for me. Ah, that's great. Not sore there at all?
A bit like.
Whereabouts?
Just at the back.
At the back?
Yeah.
Not here. All right. My mate's going to do a few little tests on you now, okay?
My phone's in the car.
Is it? I'll have a little look. I don't I'm going to find it, like. Anyone found a mobile phone?
John wants to find his mobile in case his family are trying to contact him.
Got his phone. That's all he wanted. There you go, mate. That it?
Yeah.
All right, we'll leave it here for now, all right? So he won't think he's lucky.
Ready when you are, eh? Cheers. Don't be getting upset, you're all right? Okay?
Yeah.
Ken and Ian take John to the A&E at Aintree Hospital.
Oh, we're nearly there now.
At the Royal Liverpool Hospital, consultant Ara Sapaya is the senior doctor on duty.
Liverpool playing today. In fact, Dr. Iga, my colleague, rang me on the way to the match, and it's going to kick off in a bit. I don't think we'll do well, though. What's happening with that lady?
Ara will have to wait to find out, as he's called to resus for a patient who needs his urgent attention.
You do that and I'll come see her now. Hello. Yeah, my name's Ara. I'm one of the A&E consultants. Has this ever happened to you before?
Frequently, but it's never been this bad.
Never been this bad. Do you have any other medical conditions apart from high blood pressure?
Yeah, angina.
You have angina as well. It just started on its own.
Barbara Whitfield's nose has been bleeding for over 10 hours.
Waiting for it to stop.
Okay. All right, I'm going to have to put 2 things in your nose to stop the bleeding, okay? All right. Can I take your glasses off for a minute?
Yes.
Just help you a bit. You okay?
Uh-huh.
Blow your nose for me. You did really well. Here. Okay. These things work fantastically well. You put them in the nose, and then if you put water in them, they expand, so they compress where it's bleeding from, without you having, because you can't see, because it's inside the nose, you can't really see anything. Head back. Okay. I'm going to start with this nostril, okay?
Okay.
All right. It's not very nice, this. I am sorry.
Ah!
That's it. That's done.
Oh.
That's done.
Thanks.
Okay. Sorry. Sorry. What I'm doing now is expanding it with a bit of water. You okay?
Uh-huh.
You're doing really well. It's not nice, this. I know it's not nice. Excellent. Okay.
Okay.
You catch your breath. Put a smaller one on the other side, okay? Just bear with me. That's it. Well done. Well done. Are you feeling better now?
It doesn't feel too bad now.
You look better already. You're not coughing up blood anymore. You looked like a vampire 2 minutes ago, didn't you? I mean, I don't mean to scare you, but nosebleeds are very serious. If you have a nosebleed and you can't stop it, you need to come straight into hospital. I've seen people actually be very, very ill. What we need to do is get the ENT doctors to come down and have a look at her. She probably needs to stay in overnight, the amount of blood that she's lost. Okay? Sure?
Thank you,
yeah. I'll be back in a minute, okay?
Hello, Amy, Royal Sister speaking. Okay, great, thanks. Bye. A 4th mate open fractured elbow. It's open fracture.
Oh, an open fracture.
A&E specialist Rob Hunter is also on shift. He's needed immediately in resus.
He's fell 12 feet onto a concrete floor. We've had him on the outer notch on the way in.
Yeah, we'll get you across onto this trolley and I'll get you some pain relief.
Michael Evans fell whilst at work.
Sorry about that.
Can I have 10 of morphine, please? So you feel a lot better once you get this pain relief into you. What did you fall off of? A ladder. About 8 feet, I was told, is that?
Probably higher.
Any medical problems? High blood pressure. I'll give you some morphine now, Michael. It's going to make you a bit lightheaded. Sorry. Just check the capillary leaf there. It's fine. You feel me touching you there, Michael?
Yes.
There you go, Mum. It's only oxygen.
He's got a potential compound fracture here. There's a fracture with the bone sticking to the skin. Sorry. So there's an obvious hole going into the joint. One of the things we worry about is bone infection, getting in from the outside world into the bone. Given an osteomyelitis, it takes months and months to treat that if you get an established bone infection. Sorry, might sting a little bit. There's an antiseptic dressing and I'll give him a shot of intravenous antibiotics. You all right with that now, Margie? Main concern is the elbow. There's multiple fractures right through the joint as bits have been knocked off and displaced. I mean, the best way to describe it is it's a mess. It's just smashed to bits. I'm just glad I'm not an orthopaedic surgeon that's having to repair this. Michael, have you seen your x-rays? Basically, that is a mess. It's the only way I can describe it. This will need an operation. It's going to need an operation probably tonight. The reason being, any movement of the elbow could cut off the blood supply to your hand. I'll come back and see how you're doing. Okay, thanks very much.
I've one emergency message. Elderly male who's coughing blood over.
Rapid response paramedic Leslie Millen is on her first shout.
This one is for an 83-year-old laceration. So that's all it's come up with so far, so we're not too sure what it is.
You have arrived.
An ambulance crew is already on scene in case Alan Dixon needs to go to hospital.
Hello, hon, what's been going on?
Just felt a bit of uncomfortable in the throat. Spat out and it was blood.
Have you got any pains anyway?
No,
Any tummy
no pain
pains,
at all.
no
No,
chest
nothing.
pains,
No.
headaches?
Nothing.
Have you
Just
been
a little bit of dizziness.
No heart problems, heart attacks, angina?
No.
Did you say coughing up or vomiting up blood?
No, just coffee. When it's spit out,
Yeah.
it's there.
Right. We'll just check his blood pressure now. Have you been wheezing at all for anything?
No.
117/106.
No? Your blood pressure's up a bit now. What's your blood pressure normally like?
Good.
I'm just going to check that you haven't bit your tongue. And that's where the blood's
Possible, I
coming
hope
from.
so. I might have done, mightn't I?
Right? Yeah, if you got some water or something. Because he's saying that he's coughing up blood and spitting up blood. There seems to be a lot of blood on one side, so I'm going to check that he hasn't bit his tongue on one side. Got something for him to spit it into. Just swill your mouth round, swill your tongue round. That's it. Right. Do you know your mouth for me, hon? In fact, it looks like it's your gum. Yeah? You've got a tooth missing here.
Yeah.
And that's bleeding. You haven't been eating your tea and you felt something crunchy in your tea, have you?
I haven't felt a thing, honestly. I don't know what's happened.
You've had a tooth. You've swallowed it.
I must have hit myself.
You'll have to wait a couple of days for it to come back out again.
Oh, thank God for that. I really did panic.
No wonder, understandably. Anytime you get anything at all like that, you don't hesitate, you fill us
I haven't had a tooth out, you see.
You have now?
I know, I have now.
See the dentist in the morning.
God, thank you very much indeed.
You're welcome, hon.
Back at the Royal, Ara has a queue of patients to see.
What's your back?
Hi, my name is Ara. I'm one of the consultants here, okay? Where are you from?
Iraq.
Iraq, okay. Do you speak any English at all?
No, I only speak English.
You just spoke in English then?
No, little.
Okay, all right. What's the problem?
She had a knife cut about 10 days ago.
But all that is pretty badly infected, actually. This is quite serious, this.
Yeah.
We have to cut this and let some of the pus come out.
Yeah.
Do you want to follow her?
Yeah.
Okay. Thank you very much. I'll see you in a bit, okay? Hi, John. What do you do for a living, John?
Company director.
This is the 4th time you've had a fracture.
You don't call me lucky for nothing, you know?
You've seen your X-ray? You have?
I've seen it from a distance.
So you've snapped it in, sort of in the middle. We need to straighten it for you. How would you do this?
No, I was just going out to the kitchen. I came back from the football. I must have woke the dog up, and the dog jumped off. I jumped off, and I just banged my hand against the wall.
So I'm going to give you the anaesthetic, and then leave it for a few minutes for it to work. The fracture is there, so that when I put the needle, eventually you don't feel it too much. Okay. Sharp touch again. Okay. You okay? Now I'm going to leave you for a few minutes.
Okay.
How are we doing, guys? We'll have a look. Okay. Don't look.
Alright, love.
Okay, you alright? Okay, so I'll just do it very gently. Okay, you alright? So all I'm doing is opening it up and letting all the clot and the pus come out.
Alright, fast.
She's very tough, this lady. But the important thing now is to make sure we dress it so it heals.
Thank you.
You do speak English. She's amazingly brave. She wins once.
Alright, fast.
How's the hand feeling? No big sign to this brute force, I'm afraid. Okay, ready? I'm just literally pushing the 2 bones back into place again as best as I can. Very good. Presumably you spend hours on the computer typing.
I do 60 words a minute with 2 index fingers.
Do you? Yeah, so if you look at the finger now, spot on. What we'll do is we'll put it in plaster now.
Yeah.
Okay. It's really important to keep this in that position, okay?
So I can't drive today, no?
No. You can take your dog for a walk though. If you crash your car, you'll be in a lot of trouble.
Thanks very much.
Emergency call, please. Not sure of all the details. Police are en route, but you need to stand off till the police arrive on scene of it.
We're going for an alcoholic who's depressed. Patient can be violent, but she's more verbally than anything else.
Police are already on scene.
Did you call for an ambulance? What? You didn't? So you didn't call for an ambulance? All right. What's your name anyway? Sorry? Do we just need to check? What's your name, love? Marilyn Monroe. All right, we'll check on that now. There's nothing we can do. She's just a regular, she just phones and that's it, yeah. I've never dealt with it. It must be your turn now. Well, thanks for that anyway. Cheers for that. 164. She was talking to us, but she refused to open the door and told us to go away. It's the police we ain't going to do nothing, so I tried to get a name from her, but you come up with Marilyn Monroe. I agree with the police, there's not more we can do. She's refusing to answer the door. So basically, we can go and deal with people that need us. She doesn't want us, then there's nothing else we can do.
In resus, Ara's next patient, William Sweeney, has fallen off a roof trying to fetch a toy for his sister.
Billy, we're going to lift you across, okay? Don't panic, okay? Excellent, well done, guys. How old are you, mate?
16.
I'm going to have a look, see if there's any other injuries, okay? Because if you fall down that height, you could have had some serious injuries. You normally fit well? Any regular medication for anything?
No, it's no medication.
Apart from your neck, is it sore anywhere else?
Just, it was at the side, and went at the top of my bum.
Okay, fine.
Can we have some hands for a log roll, please?
Registrar Andy Ashton is also in resus.
Okay. Andy, this is Billy.
Yeah.
Fell down about 9 feet.
Good, I've worked.
So I'd take the head for the log roll.
Okay.
Splendid.
There you go.
Billy, Dr. Ashton there's going to hold your neck, okay? And then we're going to roll you and take you off this board. You're not going to fall, don't
Steady,
worry.
roll.
That's it.
All right, Billy, any pain up here? If it's sore anywhere else, just shout.
Was that there?
Here?
Yeah.
So that's tip of scapula.
Ready, steady, roll.
That's it. Well done, mate. That's really good. How are you feeling? It's a little bit sleepy for my liking, to be honest. Open your eyes for me. Billy, have you had any alcohol, any drugs or anything like that today?
No.
But he's just a little bit sleepy, which could be a sign that he banged his head, and even though he got up, he may have lost consciousness for a split second, so it could be a sign of concussion. Billy, I'm just going to put a needle on your arms, okay? Or watch it.
We'll move for you, alright?
Alright, Billy, sharp stab, yeah?
You're doing really well.
Simple now.
Still with us? Yeah? Sure? Okay.
Here you go, mate.
There you go. You're doing really well.
Okay?
Yeah.
All right, okay. I'm going to get an x-ray of his neck. You're alright, Billy, don't worry, mate.
Okay.
Alright, well done. Okay? Alright. Which, anywhere in the neck, you know, someone falls 9 feet, you always take it seriously, really. You can have quite a lot of cord injury, neck injury, without any disruption to the bones. At the moment, we're getting all x-rays done, and then we'll take it from there, really.
6-4 emergency calls, patient complaining of chest pain over.
Looks like we're going for a 70-year-old male who's conscious and breathing, complaining of chest pains, a collapse. You tell me what's been going on in your own words.
Got this bit of a tightness in my chest.
Yeah, he started in the match, did he?
Yeah.
OK, well, what we'll do, let's get you in the warmth into this ambulance. I'm going to do a few checks on you and see what we're going to do from there, all right? What do we call you?
Frank.
Frank Murphy was walking home after watching his beloved Liverpool when he thought he was having a heart attack.
I just got a bit of tightness in my chest.
OK. What do you suffer as a rule, then?
I'm on high blood pressure and all that, cholesterol, everything.
High cholesterol, so you're prone. OK. The pains didn't go anywhere else?
No,
just this tightness across here?
Yes, that's all.
All right, that's fine. He's under investigation for chest tightness. He's got to go for the treadmill next week, haven't you? And they've given him a spray to be on the safe side, which he has taken. We're going to do an ECG on him. Certain points on the ECG I'm looking at, if it's elevated, this line between here, or it's depressed. Your ECG looks fine, Frank, OK? Yeah. But we still need to get you down there, and they're going to monitor over a little while, because if you get this chest tightness again, they can be there at that time.
Frank's nephew John has been roaming the streets trying to find him.
That's how we found out.
Yeah, take a sit down there.
He only discovered Frank was ill by accident.
You pressed your button on your phone in your leg. I went through to the pub and Carol was upstairs in the office and she could hear everything, but no one could hear her.
So, my phone?
Yeah, so she phoned me up in the pub and I've run down. You know, give me a heart attack running a mile and a half.
I haven't missed a game. I've thrown myself out of Walton Hospital and exactly 3 times to watch Liverpool.
He's fine. He's fine.
At the Royal, Billy's x-rays are ready.
So that's the x-ray of his back. Yeah, that's where he's sore. He's not damaged the bones, and that looks completely fine to me on that view. This is the other x-ray of his neck, and that looks completely fine. And that's the hip. I was just worried about the left side up here, and that looks perfectly fine. That's pretty good, yeah. Excellent. We'll tell him about he's happy as well. Hey, a bit more weight, can't you? You feel better? Yeah. Okay, good. I'm gonna take this off. Andy, will you hold his neck for me, mate? Just wanna feel down his neck again? Yeah. I got his lateral C-spine, looks okay. Okay, Billy, don't nod. Just say yes or no, okay? Any pain up here?
No.
Here?
Okay.
Here?
No.
Can you just... We're gonna let go of your neck. Just turn it to the side for me. How does that feel?
Alright, on this side.
Okay, turn this way now. Right across. Feel okay?
Yeah.
Good. Okay, let's take all this off. Everything's fine there. Nothing's broken. Alright?
Yeah.
Questions?
No.
It's fine, mate.
Am I okay?
You're fine.
Thanks.
Okay. Alright, I'll see you later. Thank you.
Stephen Garnett is having a heart attack.
Hello, I'm Dr. Ashton. How are you doing?
He was decorating at home when he started to get chest pains.
You've not had surgery recently? No. You've got no other illnesses? No. And you've not had a stroke, have you, in the past? No. You don't have an ulcer? No. No. Are you a smoker?
I am, I'm afraid.
Yeah. How much do you smoke?
About 20 a day.
Not anymore, mate?
No.
When you're having a heart attack, you have a little clot that comes into one of the arteries of the heart and blocks it off, and that bit of tissue beyond that then starts to die. So what you do is you give a drug and that dissolves the clot.
Julia Edwards, a cardiac specialist nurse, is monitoring his condition. The treatment is called thrombolysis, but it does carry risks.
Oh, I think that's there, actually.
There are strict criteria for its use.
Oh, there's the right side. Oh, I see. What you can see here is
you get this little bump, then you get the QRS complex, then this little bit should come down to the baseline, the ST segment. It's not on the baseline.
So that means he's now hit our criterion, so we're going to give him the clot-busting drug. Right, so that last ECG we've done, you've hit that criterion there, so are you happy for us to give you that drug, the clot-busting drug? Yeah, but this drug's not without risks. You can have a bleed elsewhere, okay. If you get any pain or anything going on, then you let us know, but we'll be watching as well. All right.
Stephen's wife has stayed in resus to be with him.
Do you want to do that while I do the paperwork? We do know that by giving this, you reduce the amount of people who actually die from their heart attacks. It makes a very significant difference giving thrombolysis. 20, 30 years ago, if somebody had a heart attack, you basically held their hand and gave them some pain relief. So it's great to be able to do something now.
All right, that's it.
Fine, thank you.
Okay, sweetheart. That's fine.
Stephen's blood pressure is dropping. He'll need constant monitoring.
Get your blanket.
It's on a fairly sticky wicket, but he's in the right place, he's fully monitored. If anything does happen, if his heart goes into any funny rhythms, we can deal with that straight away. So, given what's going on, he's in the best place.
Sometimes this does happen, so don't worry too much, right?
For the next hour, all the team can do is watch and wait.
Lie down this time. Yes. All right?
Yeah, thank you.
Okay.
I've one emergency message. Child suspected choking.
We've just finished off with the last job with Mr Dixon, and now we're on to another one. For a 1-week-old baby, conscious and breathing. It's always my belief mum's know best if there's something wrong. We always go by mum's instinct. Hiya. Hello, my love. So he's a week old.
Just over here.
What's been the problem?
It just went blue and his
Yeah.
eyes rolled back.
Right.
He was choking with it.
He has been breathing a little bit heavy anyway, so I don't know, but...
What have you called him?
Benjamin.
Benjamin. Hello, Benjamin. Have you been trying to scare your mum? Has he been taking his bottles as normal?
He has.
Okay, babe. Been getting good wet nappies, and he's been opening his bowels as normal.
He has,
Oh, that's fabulous. 36-2. Has he been showing signs of being unwell in any other way?
He hasn't, has he? He's been okay, he's been quite fine.
Been winding properly.
He's looking fine now. He's a gorgeous pink colour. And he's looking right at me. Hello. You're gorgeous. He's alert, he's looking around everywhere. But could have just been the fact that he might have brought a bit of wind up and he's choked a little bit or anything. But we can pop him along to the hospital, get him checked over. And it might be something of nothing, but at the end of the day, he's too precious. So we'll go and get him checked over by a paediatrician.
Better safe than sorry.
An ambulance crew has arrived to take Jennifer and baby Benjamin to Wiston Hospital.
Thanks a lot for your help anyway.
Oh, you're welcome.
Okay,
you take care. I'm sure everything will be fine.
Okay,
all right.
Royal emergency? I've not got it. Yeah. OK then, that's great. Thanks very much, bye.
Rob is on standby for a road accident. A motorcyclist has collided with a car.
Vital signs are okay. He said you being 20 milligrams.
20. All right. Hartman's will be fine, sorry. 0.25. Can you mix it up? 10 mils of bupivacaine and 10 mils of 1% plain lidocaine, please.
That's all right, sweetheart. All right, darling.
Feel the bone there.
This
leg's very, very swollen. The femur snapped and fractured and it bleeds. It's got a big blood supply, so you can lose up to about a litre, 2 litres of your blood within the first hour. So what we need to do is get it straight and into traction. What's your first name again? It's Chris, isn't it? Right, what I'm going to do, there's a nerve here in your groin that serves your leg. Yeah, I'm going to put in a nerve block to block the nerve so that you won't feel any pain. It'll take all the pain away. A bit of a sharp scratch.
Okay.
It does sting a little bit.
You're doing really well. Life's on the way, darling. All right. Okay, you're doing really well.
This is the Donway splint, which looks like a torture device. It's fiendishly complicated. It's supposed to be very simple to apply. Essentially, it applies traction to the leg and it pulls the fracture out to length and keeps it in that position, so it minimises the blood loss. Now, what we're going to do now, Chris, is get this boot off you.
If it's really loud, I don't mind losing the boots.
Oh no, we're talking about that just to give you an idea of what we're... But it's actually working. We're actually lifting your leg and moving it around at the moment. You see it's
lying on
dropping
the
through
wet
there.
sheet. All right, well done.
Just keep taking some deep breaths. Well done.
Okay. That's tight.
Well done, Chris. Without the nerve block and that, it'd have been on the ceiling by now. It's an extremely painful fracture.
Why is that?
I suspect there's going to need an operation. We're going to need a metal rod put through it. But we'll get him x-rayed now and get the orthopods to come and have a look at him. I'll just go and speak to his wife, let her know what's happening, because she's probably quite anxious.
While Chris is taken to an orthopaedic ward to await his operation, Andy has come to check up on Stephen.
Let's have a look. How are we doing? Perfect. So his blood pressure's looking very good, and his heart rate's nice. And he just has his eyes closed and just sleep, just exactly how somebody thrombolyzed should be. So, see, he's got his wife's doing the worrying, but he's looking chilled, and that's exactly right. And his mum. Yeah. Looking good though. It's looking all looking good. Much better colour actually. Yeah. Good.
Stephen is now out of immediate danger.
His heart attack stopped now. We've stopped it in its tracks by dissolving the clot that was causing the heart attack. So, you know, he had a problem and we've solved it.
Thanks very much.
Pleasure.
Cheers.
Absolute pleasure.
Thank you very much.
Oh, it's a pleasure.
He's going to the cardiac care unit for observation.
I can't even walk anymore. I'm absolutely starving. It's a bad shift. My mum warned me there'll be days like this.
Dr. Spire, contact wages, please.
Oh my god.
Barbara had to have her nose cauterized to stop the bleeding. She spent 4 days in hospital. Michael spent 9 hours in surgery having his shattered elbow repaired. With physiotherapy, he was able to return to work after 5 weeks. Chris needed a 12-inch pin in his leg and 2 more in his knee. It will be 8 months before he can walk properly again.
Stick with us tonight here on 3, as next tonight we stick with the medical mayhem as Dr. Dick, the Death Detective, is back in a few minutes.